Okay, we're looking at neurology, case number 6. A 10-year-old boy is brought to the pediatrician by his parents for evaluation of short stature. The child is below the 10th percentile for height. Further evaluation reveals a bitemporal hemianopsia. MRI of the head reveals a suprasellar cystic calcified mass. What is the most likely diagnosis? The hallmark lesion for craniopharyngioma is a suprasellar cystic calcified mass. The differential diagnosis for a suprasellar mass includes optic gliomas, meningiomas, pituitary adenomas, and metastases. What are the other causes of short stature? Other causes of short stature can arise from endocrine disorders including Cushing syndrome, growth hormone deficiency, hypothyroidism, and gastrointestinal disorders including malabsorption syndrome such as celiac disease, lactase deficiency, or inflammatory bowel disease. From what other tissue does the tumor in this condition derive? Craniopharyngiomas are rare tumors derived from the Rathke pouch. The Rathke pouch is an invagination of ectoderm lining the primitive mouth that develops into the adenohypophysis. What tests or imaging tools may be used to confirm the diagnosis? CT scan or MRI of the head can visualize the cystic calcified suprasellar mass characteristic of the craniopharyngioma. Plain radiographs of the skull can detect advanced cases. Testing of the pituitary axis and optic pathways can determine if the tumor has affected these structures. What is the epidemiology of this condition? Craniopharyngiomas exhibit a bimodal distribution with one peak among children and the second among patients 55 to 65 years of age. It is the third most common intracranial tumor in children. What are the clinical manifestations of this condition? Craniopharyngiomas are slow-growing tumors with a highly variable clinical presentation. Symptoms occur because the tumor involves the pituitary gland or the optic chiasm. Patients may present with growth hormone deficiency, hypothyroidism, or central diabetes insipidus. Visual disturbances and headaches are common.